The most common types of cancer that many women face are breast cancer, cervical cancer, and ovarian cancer. Cancer begins in the cells, which make up tissue within your body. Sometimes the process of cell growth goes wrong and the cell's DNA or blueprint becomes damaged. New cells form when the body doesn't need them, and old or damaged cells do not die as they should. When this occurs, a buildup of cells often forms a massive tissue called a tumor. When cancer cells travel to other parts of the body and begin damaging other tissues and organs, this process is called metastasis and leads to later stages of cancer diagnosis. Treatment options for most cancers include chemotherapy, in which drugs are used to slow down cancer growth, radiation therapy, which uses high-energy rays to kill cancer cells, hormone therapy, which uses hormone-inhibiting drugs to prevent cancer growth, targeted therapy, which uses drugs that block the growth of cancer cells in specific ways, immunotherapy, which uses drug treatment to help your immune system fight cancer cells, and surgery, which removes the tumor and nearby regions. Maintaining physical health and wellness, as well as nutrition, also keeps your body healthy and improves response to other cancer treatments. It is important to find a provider and discuss treatment options as soon as you have been diagnosed with any cancer type. The most common type of cancer is breast cancer. Breast cancer is a disease in which malignant or cancer cells form in the tissues of the breast. Breast cancer is diagnosed through mammograms and tissue biopsies. Mammograms are X-rays which are used to produce an image of breast tissue. The images are then examined for abnormal areas. Tissue biopsies are when a sample of tissue is taken from a breast lump and analyzed to determine if the tissue is abnormal and may need additional testing or treatment. The signs of breast cancer include change in how the breast or nipple looks or feels, such as change in skin texture or enlargement of pores, nipple tenderness, lump or thickening or lump in the breast. Change in breast or nipple appearance is also a sign and includes unexplained change in size or shape, dimpling, nipples that are slightly turned, and skin that becomes scaly, red, or swollen. Any nipple discharge, particularly clear discharge or bloody discharge, and persistent unexplained breast pain are also signs of breast cancer. There are many things that you can do to prevent your risk for breast cancer. These include performing monthly breast self-exams at home, completing mammograms every 1 to 2 years, and maintaining healthy habits. At-home exams include checking the breast for lumps, discharge, or changes in appearance. The second most common type of cancer is cervical cancer. Cervical cancer is a disease in which cancer cells form in the tissues of the cervix. The cervix is the lower part of the uterus that connects to the vagina. HPV, a sexually transmitted infection, also plays a role in causing most cervical cancer. Cervical cancer is diagnosed through tissue biopsies and endocervical curettage, a method in which a brush is used to take cells from the cervix to be analyzed. Early-stage cervical cancer generally produces no signs or symptoms. Signs and symptoms of more advanced cervical cancer include vaginal bleeding after intercourse, between periods or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul odor, and pelvic pain or pain during intercourse. Some factors may increase the risk for cervical cancer, including having many sexual partners or early sexual activity, which increases your risk of HPV, having other sexually transmitted infections, a weakened immune system, smoking, which is associated with squamous cell cervical cancer, and exposure to miscarriage prevention drug called DES, which increases risk of certain type of cervical cancer called clear cell adenocarcinoma. There are many things you can do to prevent your risk for cervical cancer. These include completing yearly Pap tests, which detect abnormal cells in the cervix, including cancer cells and cells that show changes that increase the risk of cervical cancer, taking an HPV DNA test, and maintaining healthy habits. The third most common type of cancer is ovarian cancer. Ovarian cancer is a type of cancer that begins in the ovaries. The female reproductive system contains 2 ovaries, one on each side of the uterus. The ovaries, each about the size of an almond, produce eggs, as well as the hormones estrogen and progesterone. Ovarian cancer often goes undetected until it has spread within the pelvis and abdomen. At this late stage, ovarian cancer is more difficult to treat. Early-stage ovarian cancer, in which the disease is confined to only the ovaries, is more likely to be treated successfully. Ovarian cancer can be diagnosed through pelvic exams, imaging tests, and blood tests. Early-stage ovarian cancer rarely causes any symptoms. Advanced-stage ovarian cancer may cause abdominal bloating or swelling, quickly feeling full when eating, weight loss, discomfort in the pelvis area, changes in bowel habits such as constipation, and a frequent need to urinate. Older age, family history, and estrogen hormone therapy may increase the risk for ovarian cancer. There is no way to prevent risk of ovarian cancer, but considering birth control pills may lower the chances. Detailed information on breast, cervical, and ovarian cancer, along with additional resources on other women's health topics, are provided in the links and PDFs included below.